app. Otherwise, if you want to sign up online, here is the link, medica.com with MHC, and then there'll be registration links. So it'll take you directly to where you need to add your information. If you're going to do it online, if you're the contract holder, you would search on this screen. It says, let's get started, and it asks for an organization. You would want to type in Minnesota Healthcare Consortium. You choose that, and then you just complete your registration. Oh, I thought if they're spouses and dependents, they would type in My Health Rewards, Medica My Health Rewards, and they would choose that. So there's a bunch of slides. These will be shared. These were shared. Actually, they're the same slides as last time. So they're probably posted somewhere on your intranet. So if you forget, they're out there. If you do have a Medica member portal account, there's direct links in there as well to My Health Rewards. So I'm going to stop sharing, and then we're actually going to go into the desktop version. So let me just speed by here. And then I will share my screen and we'll kind of walk through everything. So share that. And here we go. Okay, so this is the desktop version. So when you go, and sometimes it's easier, I think, sometimes to create an account on your desktop rather than typing on your phone, but whatever works for you. So this would be the landing page where you would start. It would say create your account. And you would click on that. If you're the contract holder, here's where you would type. And as I started typing Minnesota, it automatically populated with MHC. So you would choose that. And then it's just going to ask you first name, last name, date of birth. I'll ask you for your country, and then I'll ask you for your state. There is this is just for the end, for the rest of this year. There's an enrollment phase. This will be phasing out. We just did this as an additional security precaution for the end of 2025. 2026, this enrollment phase passphrase will no longer show up, but it is Medica, capital M, and then you space, and then it's wellness with a capital W. So we type that in. And that's how you would create your account. And then there'll be like some privacy agreements, and then you create your username and password. So that's how you go about creating your account. If the spouses and dependents, I just want to show you what they would type in. So if they type in Medica, and it brings up two options, they would choose this lower one, Medica My Health Rewards. And then everything's the same. Passphrase is still Medica Wellness. So that's how you create your account. And then I'm just going to log in to my account, and we will walk through, we'll walk through all of the different areas that you want to know about. And if anybody has any questions, feel free to interrupt me and ask questions. I want this to be as interactive as we can have it. So this is your dashboard. So when you create your account, you come out here, you'll always go to your dashboard. So I'm going to start with setting up your interests, because that kind of drives the entire experience. Whatever you choose for interests will load your daily cards. It will give you recommendations on healthy habits, journeys that work for you. So this is one of the first steps we always want people to do when they first create your account. When you change your interests, when you set them up, you get 250 points for doing it. And then if you change them every quarter, you also earn points. So it's a quarterly point earner for changing your interests. Number one, so your experience doesn't get stale, but also things change within our lives throughout the year. So we want to make sure that the content that you're seeing is actually relevant to what's going on with your life right now. So on this top board, and then for the mobile app, it would be kind of on the bottom. It's on the bottom of the mobile app. There's more with the three dots, and you drop down and there's topics of interest. So you just click on that. And these two are always getting active and eating healthy are always defaulted on. So you have some content when you first create your portal. You can leave them on, you can turn them off, and it's just as simple as clicking on them. So you can see you can load more. It'll show me, like right now, I've got healthy relationships and financial well-being turned on. if you go down to these sections, it will, if you click on them, it will tell you kind of what falls under there. So those three, focus, I've got one selected. So brain health, there's managing stress, things, staying safe. So it's not just physical well-being, with physical activity or nutrition or sleep. It's a well-being offering. So it's financial, it's mental health, it's DEI, it's sustainability. And then there's specific health situations. So if you have one or somebody you know has one and you want to know more information about it, you can click on that. It will also give you content to support and learn more about these conditions. So I have women's health turned on, but it's easy as just, let's just say I'm going to do blood pressure and done. And then it will, and now I've earned my 250 points for changing my interest this quarter. So it'll kind of push that content, new content to you. So that's how you do your interests. And then on your homepage, if you haven't done your health assessment, so that's called the health check survey, it will show up on your dashboard until you've completed it. So you can find it either here, if you haven't done it before, it will show up every single time in your card carousel. Otherwise, if you go to these tabs right here under health, and you go down to surveys, you can take the health assessment as often as you would like. You get 1,000 points for taking it for the calendar year. But if you've done a lot of work and you just want to retake it to see like, oh, is my score better? You can certainly do that. So you go click under the surveys, or you can take it from your dashboard on your home page. And there's the health check. So you just click on start. And then it'll kind of tell you what the survey is about. So you click on start survey, and then it'll ask you questions. So if you've already taken it, some of this is already filled in. So what was your assigned sex at birth? You can choose intersex. You can prefer not to answer it. I will let you know on the health assessment, if you choose one of the last two, when you go to the My Care checklist, the portal doesn't know your gender. It only knows your age because you had to enter your date of birth when you created your account. So the My Care checklist feeds you your preventive care activities, and it's based off of your gender and your age. So if you choose not to answer this, you'll get all preventive care activities for your age. So if you see something where you're like, well, why is it giving me, if you're male or identify as male, and you see something for a pap smear and you're like, well, that's not for me, it's because of that. So it's just picking up on your age. So I just wanted to call that out. So you just answer that, you click next, and then here's another gender question, and you choose your answer. It asks, race questions. Again, you can choose, I prefer not to answer. But then it'll get into more questions about safety and nutrition and sleep and medical conditions. So let's just say I almost always eat that. So you keep going. It takes, I'm not going to go through the whole thing. It takes maybe 10 minutes of your time. You can, and there's a section where you can enter biometric screening information. So like your labs that you get done. So it'll ask for like your waist circumference, your HDL, your LDL, your blood glucose. So if you have those numbers from your physician, or your numbers, you can enter them in. If you don't know them, you just skip over it. But then at the end of the health checks, I'm just going to close out of it, go back to my survey. You'll get a number. So it'll tell you like 100 is where you want to be, and it'll tell you what your health check number is. So you kind of get a score. And then at the end of that did not like that. So you'll get recommendations. So there'll be an entire sheet that says, based on this, we recommend you do this. So it gives you recommendations on areas within the portal to check out, and to maybe do like certain journeys or turn on certain interests, or maybe focus a little bit more on this. But that's the health assessment. So we have that. And then I'll go to the well-being goal, since they're all kind of tied together as one of the things you want to do first. So if you go into your profile again, it's under more and the dots, and you click under my profile, there's a bunch of information. You can fill all of this out if you'd like. You don't have to. It will show the devices and apps that you have synced. And then right here, this is visible. Again, it notes like you're the only one who can see this. You'll see your well-being goal. You'll see mine is sugar intake. I'm terrible at it. This is something I know I need to work at. I love sweet things, and we all know it's not good for you, but some is fine. But that's my active goal. So you can choose whatever you want. There's this little pencil right here. You click on edit, and then you change it to whatever you want. I will, oh, it already says I will walk 5 more minutes a day. It can be anything. I will try not to eat potato chips, whatever. Doesn't matter. You're the only one who sees it. It's important though to create a well-being goal. I mean, it can be even like financial. I'm going to try to save an extra $10 a week, anything. Because once you have that goal, it's something to work towards. So if you don't have a goal, you're really not working towards anything. You don't have to share it with anybody. We certainly don't know it. Your employer doesn't know it. We're not going to go back and ask you if you've met that goal, but you just have something to work towards. And then you just save it. And when you do that every year when the program year resets, you get 500 points for setting your well-being goal. And they give you examples, but again, it can be anything that you want to put in. So that's how you do the well-being goal. Again, it's under more and under your profile. And then the challenges. So if you want to do, and you guys have the ability, so for my account, you won't be able to see how to do it, but you guys have the ability. Oh, no, you don't. So I was thinking you had the ability to create your own challenges, but you don't. So if you go under social, and then there is a challenge live right now. So it's good timing for us to do this. Social, and then there's challenges. So it shows, if I just click on challenges, there's also an event calendar under here. So it'll show you the challenge that's available. So if I join the challenge, it tells me, what it's about, the steps, all of the information, and then you just click on let's get started, and you can create a team. So I can see the teams that have already been created. I can search in by, say, one of your colleagues is on the team, you can type in their name and search them up and join their team, or you can create your own. So we'll just do walking team. Oh, when I did type in, it showed me more, so I don't want to really create this one, but it will create a team. I'm not going to do that because that'll mess up with the current live challenge. But then you can there can be 5 people on a team. So you can invite colleagues that you think might want to do it with you, and they can join or not join. And then as you go through the challenge, you get different areas that you unlock and learn different things. And it runs for 2 weeks. You earn points for doing it. You can win the challenge. It's fun. We do 6 of them throughout the year. So this one is live right now. Just let me get out of there. Well, it starts in 5 days, so it goes live on October 13th. Registration is live right now. So you'll get emails. You should have gotten an email when it went live saying, hey, registration is open. You'll get an email when it starts. So those are the challenges. There'll be another one. So this one's October. There's one more in December, and then there'll be, so every year it's 6 challenges. So that's how you do the challenges. And then the most important piece is your rewards and how you redeem them. So there's 2 ways to get to the rewards. So it's always on the home page. Again, it'll tell you here are the different levels. Mine are all completed, but you get little check marks and this turns green as you get towards your different reward levels. It'll always tell you how many current points you have. If you drop down, it reminds you how many days left you have to earn your rewards. So again, runs on a calendar year, December 1st or January 1st through December 31st. So the points are going to reset on January 1st, 2026. Your points reset to 0. So the game starts all over next year with all new earning opportunities. I do want to point out your reward dollars, as long as you are eligible for the program in the next year, your reward dollars can continue to roll over. So if you click on the rewards page, it'll take you to rewards. You can also do it from the home, and there's rewards, takes you to the exact same page. It'll tell you over here your total balance, so your rewards cash you have available to spend. It'll show you under here your reward progress. So far this year, I've earned $210. So I'm $15 from the max for the year. And then it shows me again the check marks on the levels and points that I've earned. Reminder, there's $85 or 85 days left for me to earn. And then here are those action rewards. So there's a check mark saying, you've earned your preventive care health checkup. And then for my 20-day triple tracker, it shows how many days out of 20, so of the 20 days for October that I've gotten that how many days left I have basically. So I've earned 6 days out of 20 so far for my 20-day triple tracker. When you earn that, this will also give you a green check mark for the month. So this is where your reward dollars sit. And again, they will continue to roll if you don't want to redeem them this year. But so you'll get kind of how to earn, you'll see your earnings history. But if you click right here on spend, it gives you your options. You won't see spend if you don't have anything in here, but if you do have money in here, you click on that spend. You can shop the store, so you can purchase merchandise in the store. Works like any other online store. So you just go in there, purchase your device or whatever you want in there. I'll go to the store last because sometimes it lags behind. You can get a gift card. This is what the majority of people do. So when you click on the gift card, it shows you all of your options. So MasterCard, there's a bunch of different options. There's Target, there's Amazon. So you have a bunch of options to choose from. Home Depot, Delta, if you're staying for a vacation. You can just click on, we'll just go to the top, MasterCard. It tells you, type in here, tells you how much you have to spend. You put in the amount, and then you'll get an email for your gift card. Simple as that. Or you can make a donation. So they have some charities that they have, or you can choose a charity of your own. So you can do that. And then if you click on shop the store, I'll just go to shop now. They have different products. So when you click under it, there's a ton of different things: camping gear, electronics, fitness tracking devices. So let's go to that. And let's say, if you want to buy, I'm going to buy the Apple Watch. So you just buy it, you put it in your cart, and you can use your reward dollars to buy it. So I have $237. So I can use all of it to apply towards the watch. And then it will just ask me for a credit card to cover the rest of the cost of the device. So you can use it. You don't have to have, you don't have to be like, well, now I have to find something for $237.76. You can just make up the difference with a credit card. So that's that. And I have 3 minutes left. So I went through that really quick, and I wanted to make sure I left time for questions with the last 3 minutes that we have. So
Jackie, one of the person I wanted you to explain so the whole group can answer it, wants to know another way besides the smartwatch to do like the tracking piece.
Oh, tracking. Sure. So
Yeah.
you can do either sync a device to your account. And I do want to call out, we should call this out to the Aura Ring. If you have that, that's a new device that's available. But so you can either sync a device, or you can manually enter your information. So let me just go back and show you how to do that. So on the home page, or if you go under here, under home right here in stats, either way will take you to the same page, but here's a stats page right on the dashboard. I just click on that and then say I want to track my workout. And I take today, and let's just say I am going to go for a walk at lunch. So let's just say I'm a moderate pace walker. I'm going to walk 45 minutes. It automatically converts it to how many steps, and then I can save that. So I get points because I've got a healthy habit. I've got a physical activity healthy habit, but then I also get the points for walking 4,500 steps. If you want to do steps, you can just click on it and add your steps. You just type it in, add my steps, and say I went for that walk or whatever I did. I went for a run, but I knew that typically it's 10,000 steps that I take. You just save it, and you can do that. You can do that with anything on this stats page. Well, not the active minutes, because that is a tracking device. But you can do it with workouts. You can do it with your sleep. So you can type in like you slept for 6 hours, save that. So you don't have to have an activity tracking device. You do have the option to manually track all your stats, and that's where you do it either from this home tab, click on stats, or from your dashboard. I do want to call out though for if you're manually adding your information, it'll only give you points for 7 days into the past, because the idea behind the well-being portal is to be actively thinking about your wellness and your well-being. So we want you to engage in it more than just like once a month. So there is that little caveat that I wanted to call out. With an activity tracking device, it'll sync your data 2 weeks into the past because they know it's validated data.
Oh, Jackie, you nailed it. 12 o'clock on the
Thanks.
dot. I know we started a couple minutes a little late, but if anybody has any questions, feel free to reach out to like your wellness lead. I mean, you can contact your person, like your HR or your wellness coordinator at your organization, or you can like reach out to one of us, your wellness lead, for each co-op as well. So thank you, Jackie, so much. It's very informational. We'll be sending this out later this week, the recording. But others, Nicole, do you have anything that you want to close with?
I don't think so. Like Hannah said, reach out to your wellness lead if you have any questions at all. Great job, Jackie. So much great information quickly. We had a lot of good questions in the chat. Thank you for participating with that, everyone. And yeah, thank you so much for coming.
Yeah, and hopefully see you at the next webinar. Bye, everybody.
Bye-bye.
Hi.